Hi, my name is Jessie Ahmet, and I am your host of Valley News Now, and I have two amazing guests here for you today. We're so pleased to have you on our show in Fargo, North Dakota. And as we enter this new phase of the pandemic, there's so many changes on the horizon, and it impacts how we get medical care. So our next guests are the founding partners of Primary Care for America, which is a new collaboration of experts committed to educating people about the value of prioritizing high-quality primary care for everyone. Joining us are Dr. Tony Richards-Rowley, a pediatrician and member of the Academy of Pediatrics, and Dr. Felix, say your last name for me.
Valbuena.
Valbuena, thank you so much. A family physician and leader with the National Association of Community Health Centers. Dr. Valbuena, what is primary care and why is it so important for our overall health and well-being?
Well, primary care plays a crucial role in supporting the overall health and well-being of individuals, families, and communities. And it includes day-to-day care to prevent, diagnose, and manage chronic disease. For children, comprehensive primary care includes regular well-child checkups, immunizations, and screenings. And for adults, it includes routine physicals, screenings and exams, blood pressure checks, blood work, and behavioral health services. Ultimately, primary care ensures that patients can receive the health care and services they need to be healthy.
Thank you so much. It is so important, and I feel like we get so busy, it's easy to just push past that and forget those appointments. So I appreciate you explaining that. Dr. Richards-Rowley, the COVID-19 public health emergency has now ended. I can't believe it. It's such a wonderful experience. What can families do to ensure that they don't experience disruptions in their care?
So during the pandemic, the United States took important actions to safeguard patient access to primary care, like protecting health insurance coverage and making it easier for people to connect with their doctors using telehealth. Additionally, a policy was put into place that no one lost their Medicaid coverage during the public health emergency. With the public health emergency ending, states are in the process of reviewing their programs and checking to see who is still eligible. During this process, we expect around 15 million people to lose Medicaid coverage, and unfortunately, this includes 5 million children. The COVID-19 pandemic underscored the importance of primary care at a time when Americans were often looking to their physicians for guidance on how to navigate the crisis and keep their families safe. It is essential that we keep working to advance this progress.
Thank you. Dr. Valbuena, what can we do to ensure access to primary care for all Americans?
Well, it's important that we strengthen the primary care workforce, continue access to underserved communities through things like telehealth and community health centers. And we also need to protect and expand Medicaid. Importantly, we need help from policymakers to protect and expand access to primary care services. We know that more than 1 in 5 Americans rely on Medicaid for their health insurance. And this includes children, parents, seniors, pregnant people, people with disabilities, and low-income adults.
I think so often we think that it's just related to seniors, and it's so great to point out that this is also related to children, people of all ages, and we really can have an impact by contacting our government officials and pushing for those things to go through. So Dr. Valbuena, where can viewers and listeners go to learn more and possibly take some action steps?
Definitely. Visit primarycareforamerica.org, primarycareforamerica.org, to see what's possible when we prioritize primary care.
Oh, wonderful. And I will put that link on underneath our interview, primarycare.org. Did I get that correct?
Primary Care for America.
Thank you. Primarycareforamerica.org. That's always good. We can say it a few more times for people. Thank you again so much for your time. I appreciate it. I, again, appreciate your time. I know you've got lots of national interviews to do, so I will let you go. But thank you again. You guys have a wonderful day. Primarycareforamerica.org. We appreciate it.